Hello. Let's go over muscles of head, neck, anatomy for the dental hygiene course, Biology 116. And this is basically what we're going to be doing. You should also look at the more detailed objectives that are posted on Canvas. But basically, we're going to locate and identify selected muscles. So I want you to be able to identify them on a picture, describe their basic action. You need to describe their origin and their insertion. We'll redefine those. And I want you to pay attention to their innervation when we get to that, which is the nerve that's causing them to contract. And then we'll be looking at the cranial nerves, their branches, and the passages through bony openings, again as sort of a prelude to where we're going when we get to the nervous system, where we'll be tying this all back together, hopefully. And then at the end of this, we're going to talk about the TMJ, and I would like you to be able to write a nice, clear, coherent essay on the action of the muscles of mastication and their action at the TMJ. So we will have already talked about their origins and insertions and their innervation and their action. I just want you to tie that together along with movements of the TMJ to describe how the mandible protrudes and retracts forward and back, how it goes side to side, lateral deviation, and how it's elevated during chewing. The depression of the mandible, those muscles are not considered muscles of mastication. So let's jump into this, and we'll start with some general comments and some definitions. So you need to remember how to define the origin and the insertion of a muscle. They are both the attachments of the muscle. So the origin, you can't just tell me that the origin is where it begins. That won't cut it. The origin is the attachment at the more stationary point. The insertion is the attachment of the muscle at the more movable point. So, realize that if this is a muscle cell, it's our striated muscle cell, it has an origin, and maybe this is the skull. Maybe it's the zygomatic process. It's stationary. It's not going to move. And then over the other hand, you have the insertion. And this is movable. So some of this is pretty straightforward if you just think about it. If we're talking about a muscle of mastication, well, what's the bone that's moving? It's the mandible, of course. So all of the muscles of mastication are going to have to insert on the mandible somewhere so that they can move it. That's the idea. On muscles of facial expression, the insertion is often in soft tissue, so we're moving the lips around, smiling, frowning, etc. Muscles work together in groups. So they're all of the muscles of mastication, for example, muscles of facial expression, they're working together. And okay, I thought I had some scribbling on here. Pay attention to parts of the name. So the geniohyoid muscle, for example, will tell you that it attaches to the genial tubercles and the hyoid. So, pay attention to that. Sometimes the questions are similar to, the question of what color was Napoleon's white horse? Well, okay, it was obviously white. So if you look at some of the names of these muscles, they'll pretty much obviously tell you either what they do or where they're located. So just watch for that. And we will be working with skeletal muscle. That's what we're going to focus on here. And if you remember, which I'm sure you do from ANP1, skeletal muscle is striated, little stripes in it histologically, and it is voluntary. So these muscles that we're looking at are under voluntary control. Muscles of facial expression, muscles of mastication, etc. And all skeletal muscle is under the control of the somatic nervous system. And we will go back through the different divisions of the nervous system when we get to that. But there's the somatic, which controls voluntary striated skeletal muscle. And then there's smooth muscle, of course, second of three types of muscle. And it's non-striated, which is what makes it smooth. And it's under involuntary control. So you cannot consciously contract smooth muscle. At least most of us can't. And that is under autonomic control. That division of the nervous system. So the two divisions that we have of the nervous system are the somatic and the autonomic. The somatic controls skeletal muscle. The autonomic nervous system controls smooth muscle, cardiac muscle, and glands. And what we'll be dealing with mostly in this class are salivary glands. That's the autonomic. So smooth muscle, cardiac muscle, and glands. Involuntary. And keep in mind that the autonomic nervous system is motor only. That means that the autonomic nervous system does not include sensory. Sensory is a whole different division of the nervous system. So the sensory nerves from your teeth, your gums, your skin, all of that which is sensory, it's not motor, it's a different division of the nervous system. And again, we'll come back to that. Okay, just to finish off this quick review of the autonomic nervous system, you remember that there are two divisions. There's the parasympathetic and the sympathetic, both of which are motor, both of which innervate smooth muscle, cardiac muscle, and glands. Parasympathetic is divided up pretty much by function, along with sympathetic. So parasympathetic functions are rest and digest, typically. So that's salivation and contraction of smooth muscle of the stomach, relaxation, slowing the heart down, that sort of thing. Sympathetic, again, it's motor to different smooth muscles, cardiac muscle and glands, and those are fight or flight functions. So if the parasympathetic is innervating glands, what do you think the response would be? And you only have two choices here. Well, I suppose you could do three, but we'll effectively only have two. Either more saliva or less saliva. So parasympathetic, we have a parasympathetic nerve going to the salivary glands. What's the response of the salivary gland? Yeah, more saliva. Okay, because we're digesting, right? Okay, if you have that clear, then the sympathetic is pretty much the opposite. So if we're doing sympathetic, what do you think would happen to the salivary glands? It's going to be the opposite of the parasympathetic. So if we're going to salivary glands, yeah, the response would be less salivation, less saliva. Okay, so we will be getting to that again when we do the nervous system, but it's worth, I think, introducing these ideas as we go along, so when we get there, it's not this giant mountain getting dumped on you all at once. Okay, let's move on to the next slide. Just a quick review from ANP1 when you did tissues. Here are pictures of cardiac muscle on the left, skeletal muscle on the right. And what I'd like you to pay attention to are the fine little striations, the little stripes that you see. You see those stripes? That tips you off that you're looking at muscle. It's either cardiac or it's skeletal. Cardiac muscle, though, if you remember, has these intercalated discs that you see between muscle cells. There are gap junctions there, and they electrically couple all of the heart cells together so that the heart beats as a unit. So those were the intercalated discs. If that ever showed up on an exam, it would be extra credit. But they're found in cardiac muscle. Skeletal muscle, you should recognize this, at 30 paces with one eye closed. There's nothing else that really looks like it. It's dramatic. These cells are huge. This is all one cell. And you can clearly see the striations. So enough of that. And then smooth muscle, non-striated. And where you typically find it are in the walls of hollow organs, like the stomach. The entire alimentary canal from oral cavity to anus is all lined with smooth muscle for the most part, except at the very ends. There's a little bit of skeletal. You'll also find smooth muscle in the walls of the arteries and the veins. So here is an artery, thick wall. Here's a vein, thin wall. Lots of smooth muscle in an arterial wall, very muscular. Not so much muscle in a vein. Okay. And that's all under autonomic control. Next slide. Okay. So let's do a little bit introducing some of the major cervical muscles. And let me get rid of whatever I had. Oh, okay. I can't get rid of that. So what I'm pointing out is just the origin and insertion of the sternocleidomastoid. And after you spell that out once, you can then abbreviate it as the SCM. Sternocleidomastoid. So there's everything you need to know about the muscle as far as where it is and its origins and insertions. Tells you that it attaches to the sternum, cleido for clavicle, mastoid for mastoid process. So these are muscles of the neck. The prominent muscle originating medially on the manubrium of the sternum and the clavicle. So it's sternoclavicular, sternocleido. Sort of the medial extremity of the clavicle here, and the manubrium, upper portion of the sternum. That's stationary. The insertion goes superior and laterally out to the mastoid processes. So in the picture on the right, it sort of forms this V. And then you should be able to describe the action. So if both of those muscles contract, the origin stays stationary. And if you're allowing the head to move, what's going to be the action on the neck? Lateral view. Here's the origin running out to the insertion posteriorly. When both of those muscles contract bilaterally, it's going to flex the neck. It's going to pull the head closer. It's going to pull the mastoid process closer to the manubrium as the muscle shortens and to flex the neck. So if you wanted to strengthen those muscles, you hang your head over the back of the edge of the bed and you would do a bunch of neck curls, neck crunches. I don't think anybody's really keen on that, but that's the action. Also, I would like you to be able to tell me which muscle is primarily responsible for turning your head one direction or the other, rotating it. So, if I move my head to the left, which is in that direction, so I turn my head in that direction, which is to the left, which of those two muscles contract? The right sternocleidomastoid or the left? And if in doubt, feel the two muscles on your neck. Find them. You know where they run. And then turn your head and see which one tightens. I turn my head that direction. It's this one, the right one, which makes sense. It's pulling the mastoid process more in line. Turn the head the other way. I pull the mastoid process in that direction. Okay, enough of the SCM. The trapezius, large muscle. Great one for neck massages when you all get stressed. The origin is indicated in green. It's the spinous process of all of the cervical, thoracic vertebrae, and the base of the occipital bone. It's all origin, it's all stationary. All the fibers run out to insert on the shoulder girdle. They insert on the spine of the scapula, which is indicated in the left-hand figure with the dashed line, posterior view. So there's the spine of the scapula. And the superior fibers and all these are running up to it. So you can move the scapula in lots of different directions depending on which fiber groups are contracted. And it wraps around the shoulder anterior a little bit and inserts on the lateral extremity of the clavicle. So that's the trapezius. And I think we're going to stop. The next unit will be on muscles of mastication. So look at your objective sheet that's posted on Canvas for the muscles that you need to be able to recognize. So far, we've done the SCM and the trapezius for these major cervical muscles. The SCM also, as we did earlier, divides the neck into these anterior and posterior cervical triangles. Okay, see you soon for the next unit.